Hello, Internet! Today we are going to talk about when you can or cannot receive a massage. So, short answer is you can almost always receive a massage, but the type of massage may vary depending on what you have going on. So, I've seen people right after surgery or right after an injury, and I still work on them, but they don't get the same type of massage as when they're just coming in with like typical aches and pains. So in some situations you might be getting a deep tissue, and then if you've just had an injury, deep tissue would be contraindicated, so we would probably do more of like a manual lymphatic drainage. Now, that being said, there are some types of contraindication that are either almost always a no-go for massage, or if you've got going on, you shouldn't be getting a massage. And they everything is situational, but generally speaking, these fall under that category. Okay, so if you have any of the following going on, you probably should not be receiving a massage. If you have any contagious diseases, this is more along the lines of things like the flu than it is other things, but still, if you're contagious, you should not be getting a massage. And a big part of that is because your massage therapist does not want to get sick, especially if you come in, let's say John comes in, he's got the flu, gives it to me, I don't realize it at first, and then I give the flu to like the rest of my clients that day. So we're all sick, and it's all John's fault because John didn't stay home from his massage. If you are sick, just let your therapist know. Now, that being said, let them know as soon as humanly possible. If you were throwing up the whole day before, you're probably not coming in for your appointment, so reschedule. Speaking of vomiting, if you're vomiting or have diarrhea, if things are leaving your body outside of your control, you should not be getting a massage. You should not be on the table. That is an accident that no one wants to deal with. So that's a situation. If you have a fever, also, just reschedule your massage. It can be a little too much work on the body to be getting a massage when it's already trying to take care of itself and heal. Not that massage isn't helpful and it can promote healing, but sometimes it'll push things through your body too quickly. I've gotten massage when I'm sick because massage school, you have to get massage every day, and they don't really care if you're sick or not or whatever. If you want credit, you're getting work done. So I have gotten a massage while sick, and weirdly, I think I got better faster, but I got worse, way worse before I got better. Holy crap. So I just would avoid it. Certain diseases, you either can't get a massage or you need to be careful what type of massage. So that's something to let your massage therapist know if you have a particular type of kidney disease or cancer, or if you've got thrombosis, so if you've got blood clots and stuff, absolutely need to let your therapist know. In the blood clot situation, most of the time, traditional massage is pretty much contraindicated. That being said, there's a type of massage for everyone. So like I said, if you've got a lot going on, if you've had a lot of injuries, maybe it's more of a manual lymphatic drainage. If you're recovering from an injury, it's probably going to be more medical based. So just let your massage therapist know what you have going on. If you have cancer or something, you should probably see someone who's certified in oncology massage, I believe is what it is. Yeah. See someone who's got the training in that. I have some light training in that. If you are seeing a medical healthcare professional on a regular basis, if you are in the middle of physical therapy or any sort of prolonged cancer type treatments, talk to your doctor, just make sure, and they'll let you know, hey, you can absolutely get a massage, but make sure they don't do this, or make sure that they do this. And then you can take that information to your massage therapist. And they might already know, oh yeah, I definitely won't be putting my elbow into your torn quad. However, like, it's just for that peace of mind, like, hey, this is what the doctor said. Like, I've had people come in and be like, hey, my doctor said that I need cross fiber friction on the short head of my bicep tendon. All right, cool, I can do that. Like, I'm not going to fight your doctor. They went to school longer than I did. So, most of the time, like, anytime it's like an actual medical thing, I'm not going to fight your doctor. Every now and again, doctors give people weird advice, and I'm just like, well, listen. No, so those are the situations in which most of the time massage is contraindicated. That being said, even in those situations, you know, there are some like energy workers and stuff that would probably still work on you or still see you. But with being sick and things, for their benefit, you should still reschedule and stay home. No one wants to get sick. And then there are also certain types of contraindications that are more like area-based or localized. So like if you have poison ivy, let us know where you have poison ivy. We won't be working that area. If you have a bunch of like cuts and bruises, just let us know. We won't be working that area. Varicose veins will work around the area, but not on the actual vein. That's why all like massage places, for the most part, will have you fill out that really lengthy medical history. It's because we want to know, and sometimes things are pretty helpful. Like I was working on a girl for like a year. And then one day I was talking to her, I was like, man, your hips are just bananas. Like, I don't understand why they're so angry. She's like, oh, I don't know. Maybe it was something to do with that hip reconstruction I had as a child. And I'm just like, it's not in your notes. You didn't write that down. I can't just know that you had major surgery as a child. I'm not a wizard. So definitely let me know. Because even if that's not your main concern, like, it can help me know, like, okay, you've got this going on here, and it's from this. So, like, that's a whole separate thing I have to deal with. Sometimes I get angry, and my notes disappear. If you're on certain medication, primarily like blood thinners, let us know. And that's just because like you might bruise more easily. We might need to go a little bit more gentle into the massage than we would for an average person. But you can still get a massage. And that's the thing, like when we're taking your medical history, it's not because we're trying to be like, oh, this person can't whatever. But we do need to know because we will probably be changing the type of massage we do. Even if it's something very basic, like prenatal. I'm certified in prenatal. A lot of people won't do prenatal for the first 13 weeks. I don't have a problem with it because I'm certified and I'm confident in my abilities. That being said, I am just obscenely careful those first 13 weeks and then continuously like normal careful. But then like the last 2 weeks, like you hit 38 weeks and I'm like, all right, let's hit some points. See if we can't speed up this process for you. If that's what they want, I always ask. But like, it's just depending on where you're at in whatever you've got going on, the massage is different, even if it's still the same. So that's all prenatal massage, but depending on which trimester you're in, it's different. It's kind of the same situation with an injury. When the injury is fresh, we're going to act differently than when the injury is 3 months old. So just let us know. Let us know what you've got going on. If we think that it's a bad idea, we'll let you know. I've had people before be like, oh, hey, I've got a fever. And I'm like, hey, let's just reschedule. Like, it's fine. It always like hurts the tiniest bit because, you know, like it usually kind of messes up the day, but I'd rather you get healthy and I'd rather me not get sick. And I definitely would rather me not get a whole bunch of my clients sick because that does not look good on a professional level. And then if you've just got certain like target, even if it seems minor, just kind of let us know. Like people let me know like, oh, hey, I've got a massive bruise. Cool. And then sometimes every now and again, like I had someone who was like, oh, hey, I fell down, I bruised my glute And I was like, okay, awesome. I'll make sure to keep an eye for that. We'll avoid the bruise. That way it's not like super tender. Did not see a bruise at all. And that doesn't mean that there wasn't one. It just meant it was deep and it hadn't like surfaced yet. So I had to be like, hey, I don't see a bruise. So I'm just going to like lightly like palpate. Let me know where it hurts. And that way I can avoid that area and not cause you unnecessary amounts of pain. So always just be upfront and honest with your therapist. If you can't get a massage, they'll let you know. Speaking of that though, it is also personal. I know I have had issues, and I may have even mentioned this in a previous video, where sometimes people will be like, hey, I can't come in, I have a migraine, or I started my period, or I'm tired. And those are things that massage can help with. So it's a little frustrating for me when someone's like, hey, I can't come in because of whatever it is. And like, I'm like, oh, okay, are you sure? Like, I could definitely help with that. And they're like, no. And I have to take them, I have to take their word for it because I don't know what their personal pain level is. And like, yes, massage can help with a migraine. But if you're hurting so much that you can't drive to where I am, like, then you shouldn't do that. You shouldn't put yourself in danger. Same thing with like the menstrual cycle. Like, massage can definitely help with cramps, but if you're not going to be comfortable laying on the table because you're cramping so hard, like you might want to reschedule, or you might want to shorten the length of your session. That's also always an option. It's about your comfort as well as what the rules are. So the rules are blah, blah, blah. These are the things that are contraindicated. If you're sick, if you're vomiting, diarrhea, certain diseases, da, 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 da. But it's still, your body. So if you're like, hey, I can't come in because I'm in excruciating pain, I'm just going to take some ibuprofen and try to take a nap, then your massage therapist kind of has to respect that. Now, if you're like sick every single time you have an appointment, we may need to talk about, not scheduling out your appointments. And that's just because, business is business. Like, as much as I try to be more like your friendly neighborhood massage therapist, I still need to pay my bills. So if you're canceling every single time, it's not going to work. Like, as much as I would love to just accommodate, I can't. So, that's not usually an issue though. I just kind of like want to throw that out there for kind of like to cover my own butt. I don't want people being like, oh, I'll just cancel every time. Not that they would, but you know how it is. So that's the 101 on when you should not receive massage. But like I said, most of the time it's just about the type of massage. So if you're worried about it, just ask your therapist and we'll let you know. Maybe we'll have to research. Maybe you need to research. We can both research. It'll be great. So thank you for listening. Feel free to subscribe to this channel. The goal is videos every Thursday with occasional extra videos on Monday. And that would be like the stretching type videos, which I would like to do more of. But this YouTube thing, kids, it's not as easy as it looks. So, yeah. All right. That's all for today. Thank you. Bye.